Hello, ladies and gentlemen. I am O'Brien McMahon, and this is People Business. In this episode, I am joined by Brock Anderson and Tracy Awe. Brock is the Population Health Strategy Leader at Function Health, and Tracy is the Director of Strategic Alliances for Function Health. I'm not going to do too much of an intro to this as we get into it pretty much right away in the episode, but Function is a platform that provides data insights into our health. So if you think of a normal blood panel, they are going much deeper. Their standard clinical panel has 100 tests, and then they have a bunch of other buy-ups. Full disclosure, as I say in the beginning of this, I am actually a paying customer of Function. This is not meant to be an advertisement for their services, but I have been impressed by what I've heard. I do believe that having better control over our own health leads to better lives, better outcomes, better longevity, better performance. There's a bunch of benefits to being a healthy human being, and there's a bunch of benefits to helping our employees in our workplaces be healthy human beings themselves. And so wanted to bring Function on. We do get into a lot of the specifics of the platform. I just thought it'd be really interesting and a unique perspective to share with listeners of the show. So I hope you find this interesting, and I hope it helps you either with your own life and your own health, or better managing the population health of your team or your workplace as you go forward. Enjoy the conversation with Brock and Tracy from Function Health. Brock and Tracy, welcome to the show. I am excited for this conversation. I am a Function member. I've been through my first round of testing, and I just got my emails to go through my second round of testing. So I'm excited on the personal front. And then also, as an employee benefits broker, we are actually implementing Function for a high-end financial services client of mine. They're going to be rolling it out to all of their members. And so I think the concept of what you are doing around functional medicine and prevention and really helping people take control of their health, I find it really interesting. And so I'm really excited to unpack all of that with both of you today. Welcome.
We're excited to have you as a member. Thanks for having us.
Yeah, thanks for having us, O'Brien.
So let's set the table a little bit. For those who don't know, what is Function?
Sure. You bet. Function Health is on a mission to empower people to live 100 healthy years. We're a platform that enables personal health enablement. We try and focus on helping people optimize their health and get to the root cause of when they're feeling good and when they're feeling bad. The Function really is trying to address, and when we talk about the 100 healthy years at a 30,000 foot level, the notion that from 1900 to 2025, the average life expectancy of an American went from 49 years to 79 years. And so we saw a 61% increase, largely due to the just amazing technological advances in medicine. It was things like antibiotics, it was vaccinations, it was sewage transportation systems, sanitation, et cetera, that actually allowed us to see that 61% increase. But even recently, as the last 15 or 20 years, we've not only seen that average life expectancy plateau, but we've actually seen a dip. And Function's mission is really at an individual level to actually empower people to achieve what they want to achieve within their own health and help them live 100 healthy years.
Yeah, and I guess that's an interesting question. I've been wanting to ask somebody this question, so maybe you know the answer. We saw life expectancy dip. Are we expecting that's going to go back up again? I remember growing up, like in my teens and 20s, it was like, if you're in your teens and 20s, you could expect to live to 100, maybe 120. But I've also read some stuff recently where there might be a high end on that range. Do you guys
we're not going to
have any insight on that?
Yeah. An increase in the next 125 years is just not going to happen.
Yeah.
Those drivers of that plateau, even though we did have a dip during COVID-19, which was infectious disease, that went away rather quickly. It's chronic disease. There's a tidal wave of diabetes, cardiovascular disease, chronic kidney disease due to lifestyle, the way we live our lives. We believe that we can get past that and start to see that increase in the context of providing people with access to their own personal biological data. Particularly as wonderful as the healthcare ecosystem is right now, it is incomplete and people don't have the greatest experiences in the healthcare ecosystem. And we're trying to find a really meaningful way to build and introduce a category here that allows an individual to actually advocate for themselves within that healthcare ecosystem.
Yeah.
And
And to your point,
I was just going to mention, O'Brien, to piggyback off of what Brock was saying, if we're going to extend life expectancy and bring that up a bit, I think where function is tracking is three main points. If you think about function, it's prevention, empowerment, and performance. I've already mentioned and alluded to catching issues early with our proactive testing and helping people unlock earlier actionable insights, getting upstream of symptoms and claims. If you're just waiting for symptoms to catch up to, disease burden has already set in. And then I would also say empowerment. Brock also spoke to this and alluded to this. It's giving employees the power to act and not wait for symptoms to set in and catch up to disease burden. And then performance is something that you're doing all day, every day with your clients, right? Healthier people, stronger companies, healthier employees drive better business outcomes. So that's how we'll get to the bringing up the life expectancy of employees and people overall.
yeah. And I will just say, I guess this might be a good spot as we dive into function in a little more detail and we dive into health and all of this. Many people out there may have heard the name Dr. Mark Hyman. He is a very visible face associated with function. He has done a lot of podcasts out there talking about individual biomarkers and performance. I had listened to a long episode that he did on the Andrew Huberman Lab podcast. So if people want to see that and they want to go into like, how do I maximize my numbers? How do I biohack myself? I would encourage people to go check that out. We're not going to go that route in this. We're going to talk a little bit more population health and some of the impacts that individuals at large can have just by improving their biometrics and their biomarkers, but not necessarily diving into the individual. I figured I would caveat that right off the bat if anybody's, how do I improve my LDL levels?
So there's worth connecting the dots between what we hear Mark Hyman talk about, because function started with lab testing because 70% of medical decisions are based on diagnostic lab tests. Straightforward, right? The next set of data that is valuable from a diagnostic standpoint is advanced imaging. Function just acquired an organization called Ezra, and we now offer MRI scans, CT scans. And so we're stacking and building a personal biological data set to allow an individual to manage and get ahead of their health. That is what Mark does in practice and has done for years. And so that vision really is being operationalized through the context of giving everybody across the US right now in 48 states, with the exception of Rhode Island, access to function, the platform to be able to visualize their biological data, and the ability to go get easy lab tests done at 2,200 Quest locations throughout the country and a couple hundred advanced imaging centers through function scans.
Yeah. I want to go back to one point that you said. I like the 100 healthy years, and going back to longevity. We all want to be immortal in some way, right? There's just something in human beings that we want to live on and perpetuate. That's why you see people putting their names on buildings when they make donations. We all want that immortality. But in reality, until science proves us wrong, there is a shot clock on all of our lives. But even if function couldn't extend life beyond 100 years, living the life that we have healthy to the very end is big. Like that's a big thing. Any of us who are old enough to have seen family members decline and pass away, the end of life can be a very tough period, and it can be prolonged for a long period of time. There's a lot of suffering that can happen.
80% of deaths in the United States are preventable right now. And a lot of what function focuses on is the notion that if there's a misunderstanding within the healthcare ecosystem, largely driven by some broken healthcare economics that are doing things like just this week, seeing 11, 17, and 23% increases with employers that we're working with for 2026. The economics are set up to not really incentivize a proactive and preventative approach towards health. And we need to turn around and we need to change that. That's what we're trying to do at Function, is to empower people to actually detect and be able to take action on disease early in its progression. And that's men who frankly don't have access to, but should be getting a $24 PSA test, because it's possible to catch prostate cancer at stage 0 or 1 versus stage 4. Mm-hmm. That's not only going to help them, that's also going to help the healthcare ecosystem. But because we only have the opportunity to spend 8 to 10 minutes every year with our primary care physician, they can only run through 10 or 12 biomarkers. We believe that empower people with more information about their own biology, they will go advocate for themselves. And a great example would be women who are trending towards PCOS. It can take 2 or 3 years to diagnose. You may have metabolic dysfunction. You may have autoimmune related markers out of range, certainly hormone markers out of range. All those things can come together and we can help people really accelerate a diagnosis around diseases like that so they can answer the question, I'm suffering and I don't know why. We think that information can help them advocate for themselves.
So I think it sounds like we're still in the prevention bucket here. And so I guess a good question would be like, when should this kind of analysis start? Like in my business, we help clients set up biometric screenings, which is more of a standard blood panel, your 5 or 6 top blood markers. But I've even heard some pushback from the medical community on, yeah, you don't need to do that every year. It's too much. You don't really need to start that until you're above a certain age. What's your position on when people should be starting this stuff and when it can start to be impactful for them from a prevention standpoint?
Sure, you bet. Function right now is available to any adult in the US who's 18 years or older. A lot of times we're discouraged, even at that age or even going into our 20s and 30s, from actually looking at our own personal biological data. But I will tell you that despite what we may see from various different regulatory or quasi-regulatory agencies around preventative health guidelines, that they are heavily influenced by hospital systems, by insurance companies. And they're not as influenced as they should be by individuals who are actually trying to advocate for themselves. Great example would be tech executive on the West Coast who came to us, created an ERG around proactive and preventative health within his organization, got the testing done. He was sitting in front of a desk, maybe he was a part of the 996 community, sitting in front of a desk way too many hours a week and a day, was 20 or 30 pounds overweight, got his function tests, he's in his mid-30s, acknowledged the notion that all of a sudden trending towards cardiovascular disease. He's got some metabolic dysfunction going on. And between his first test, so we tested function at month 0, and then we test again at month 6, and then again at the next year. Between those tests, he was able to really get ahead of his health and start to control. He lost a bunch of weight, lost like 20 or 30 pounds. He shifted and made a very substantial lifestyle and nutrition change to go become a pescatarian. Started eating a lot of fish, a lot of fresh foods. At his 6-month check-in, when he started seeing his numbers improve in cardiovascular health and metabolic function, he also saw his heavy metals spike. So function test for lead and mercury, for example, and saw that as a result of that decision to be a pescatarian, he actually started to see, it wasn't too alarming, but he started to see a trend up in heavy metals. He didn't have heavy metal poisoning by any means, but he had to make adjustments, right? And so anyone who needs access to their own biology so they can actually track and trend their health. This is why we think that when the medical community comes out and says, hey, you're in your 20s, you don't need to get tested. What if you do want to get tested? You should have the right to go do that. So hopefully that helps.
And you
it does.
Timing. Sorry, O'Brien. I was just going to say, you asked about timing, and I think we're too late right now. We're missing the window. We're waiting until people surface with symptoms, and that's typically what triggers the need and the order for all of these labs. And then you have to go through various different gatekeepers, right? You have to go to your doctor who's going to tell you what labs they're ordering, which ultimately, like Brock just said, is going to be defined by the hospital system or the insurance company and what's acceptable and what will be covered. Some things like MRIs, if you want to go for an MRI, that's going to be prior auth. And I think timing is the issue here. We're not getting to people early enough in order to stave off chronic disease burden. And if you pull the right biomarkers like we are in function, which have been thoughtfully and intentionally pulled together, you will be able to see over time the quiet signals within your body that's indicating to you that steady climb towards chronic disease. But we're all living within a framework that 364 days outside of your annual physical, where we're just sitting here waiting for symptoms to occur. And then we issue the testing to catch up with it.
And even then, how many people do we know who had symptoms and didn't go get it checked?
That's right, because the symptoms aren't impacting your activities of daily living. And human behavior, people don't stop the treadmill until it's impacting their activities of daily living. And then they say, okay, I have to get this checked out.
Yeah. And we've seen in my work, we've just seen the incidence of different types of cancer getting younger and younger. Just anecdotally, I know lots of people in their mid 30s to mid 40s who have been diagnosed with cancer, which you hardly heard anything about that 20 years ago, 30 years ago. So I think there is a case there for sure to be checking some of this stuff early. The thing about trends, though, so I've read Peter Attia's book, Outlive. I've listened to some of his interviews too. And for those who don't know him, his sort of message right now is in its most extreme, like you have to be He-Man now so that you can be a normal person in your 90s. It's like you got to get ahead of it. And there's a glide path downward as you get older, which makes sense to me, but it's so hard for people to visualize their future selves.
That's right.
It's why people don't save for retirement. It's why we let belly fat accumulate. It's just so what are your thoughts, or how are you helping people think more long-term about their health in a way that they can understand, where they can look at a function test and say, oh, this is going to be a bad trend. I can see the future that this turns into.
Sure. Great question. I think first and foremost, just acknowledging that there's a massive amount of education that needs to take place to actually help an individual understand their own biology. 15 tests can be daunting as an individual, and function really puts a lot of its focus. And you can see this externally in what we post on social. We try and put a piece of new educational content together every day about the 25 biomarkers that impact your mental health. Or if you do have omega-3 fatty acids out of range, what are the simple nutritional or supplement decisions you can make to actually improve and impact your health? And that education is at the center of it, as is the presence of clinicians. And so clinicians are present on the function platform. They order every test, they review every test, and they provide you with a set of written recommendations around your own personal biological data. So we're going to actually unpack across 100 biomarkers or any add-ons you want to receive, which we should talk about. The reason why those tests are important, what they measure, what they could be preventing. If you're looking at ApoB, for example, you're looking at a test that's much more sophisticated than your typical LDL, HDL, triglycerides, lipid panel. Taking that information and trying to help an individual actually look at and help them understand what the action plan is. What are the foods they should eat? What are the foods they should avoid? What are the supplements they should be considering taking? And so we have a one-way flow of information going from our platform to the individual member. That has recently changed into a dynamic environment where you have the opportunity to be able to upload your EMR data and actually engage and interact with your own personal biological data, which will be coming.
What is EMR?
Electronic medical records. So you'll be able to take your electronic medical records and actually upload your past health history onto the platform, and then use the AI functionality to actually start to query your own biology. My example would be, I do have heart health issues. My lipids are out of range. I'm 47 years old. I'm in pretty good health, and I live to be fast in the mountains, if that's on a kayak or running through the mountains or skiing. And the systems have provided me with really important insights as to how do I actually continue to live that objective of mine, which is to be fast in the mountains and have fun. That opportunity exists on the function platform for everybody, regardless of what you're trying to accomplish on an individual level. And so that education about what these biomarkers are is critical. It also incorporates wearables data. So that just launched actually live this week to all of our members, 7 or 8 different platforms of wearable data where you can actually see if you have metabolic dysfunction, what about your daily behaviors and your daily data can actually help you improve hemoglobin A1C, right? What can improve glucose and insulin so you can improve your metabolic function?
I did not know that, but I'm going to go plug in my smartwatch and get that connected. Yeah. Learned it here first. That's great. That was something I wanted to ask you about too, is for better or worse, and I don't want this to sound like I'm coming down on the medical community, but there are a lot of doctors out there who aren't trained in some of these additional tests and these additional markers, or if they do know about them, they dismiss them or poo-poo them. I love the doctor that I go to, but I've brought some stuff to her and she has pushed back on some stuff. And so how do we arm ourselves? We talk about empowerment being the second goal of function. How do we arm ourselves in the right way so that we're going in and having meaningful conversations with our doctors, or that we're finding doctors that can have meaningful conversations with us?
Yeah, great question. So the reason that's happening is because it takes a solid piece of peer-reviewed science, 17 years to get from the bench to bedside. And in a lot of cases, clinicians are not encouraged, or they don't take the time to continually educate themselves, which is why a test like APOB I just referenced, which is a much better indicator of cardiovascular disease, really hasn't made its way into the mainstream, despite the fact that it's more than a decade old. It is a much better test. And so we believe this is part of the reason why it's important to be introducing and driving a new category of personal health enablement to help an individual actually advocate for themselves and say, hey, I do need that test, even if you don't necessarily know what it is as a clinician. But more importantly, and this is where the AI chat and the action plans come into play on the Function site, getting information about how to have a conversation with your doctor about what these advanced lab tests are is a critical element of being able to actually advocate for yourself in the healthcare ecosystem. I ran into the same thing with my PCP when I said, hey, my APOB levels are out of range. You don't have to worry. They don't know all that much about it. So we're also currently at the same time putting pressure on the healthcare ecosystem to say, come on, guys, let's get with this. Technology is here. We got to adopt it. This is what's better for all of us. And it's going to help us get ahead of our health and help us get ahead of healthcare costs.
And through our member stories, we have numbers of feedback. Now, this is not formally collected, but it's through our testimonials. We do hear both stories where members have very good constructive conversations with their physicians who will work with them through all of their results. And they're actually having very good conversations and come out with a care plan. Others are not so successful. We have a story, it's on our website, of a woman named Catherine who got an IGF, an insulin growth factor result that was extremely high, double what it should be. Her hormone levels, because we test for those on a regular basis through our annual Function membership, were also elevated. And her physician waved it off and said, oh, it's just menopause. But that wasn't good enough for her. And because she had the information that she did at her fingertips with the Function platform, and all of the information, she was a bit tenacious, kept digging more with physicians, and eventually uncovered that she had a tumor on her pituitary gland.
Whoa.
Which led to surgery and recovery. But again, Function, if we go back to proactive, right, prevention, empowerment, and performance, this is that empowerment piece, which is really helping people advocate for themselves. And they're coming with receipts. They have the results that they can put in front of their doctors. And if they're not getting the right answer with the current physician and care provider, they will go research out another one to get to the answers. And we have another story of Alan, who's similar. Didn't want to go on a GLP-1, didn't like the answer that he got from his physician, and advocated for himself to make lifestyle changes in order to reverse his type 2 diabetes.
Yeah, I love those stories. Let me ask you this. What is the most common pushback that you get from the medical community? If you get any, are they embracing this, or have you come under the crosshairs of the medical community?
Great question. I think the most common thing we hear from payers in particular is the notion that Function is going to go drive overutilization within the system.
Yeah.
And we know that's not the case in things like high-risk pregnancies. Like, you want to get somebody in to go see a doctor. We know that's not the case with cancer. You want to get them into a center of excellence, or you want to get them to that next level of screening. I think the community itself is actually starting to turn the corner on this and acknowledging the notion that while, yes, there may be somebody who goes in and has an additional visit with their doctor about their APOB or lipids being out of range, they're actually getting ahead of their health. They're actually taking action. This is why it's just critical from our standpoint to be able to work across the healthcare ecosystem to refute what has been a bunch of bad data around know your numbers campaigns and health risk assessments. Yeah. Employers continue to spend $150 to $200 a year on these programs that don't get high engagement and they don't drive the desired results. It's an older perspective around how to actually think about proactive and preventative health. And we think we're here to be able to change that and change that paradigm.
Yeah. You talk about like waste, right? And the work that I do as an employee benefits broker, we are looking at claims utilization all the time. And we'll see a population where 20 or 30% have zero claims. We call them $0 claimants.
Yeah.
Didn't go to the doctor last year. And people are like, hey, that's great. They're saving us a bunch of money. And it's that is not great.
It may be the silent disease holders.
Right.
Yeah. And they might be healthy, but they might also be the silent disease holders. And when something happens, it's going to pop off at a much higher rate because they're not getting checked earlier. And so there is this notion that I think people need to come to terms with where we want some medical spend. Like, it's not about eliminating all medical spend. We want the right kind of medical spend. We want Just
I
like
can
if
give
we're
you a
going to,
specific example. We should talk about segments. How do you think about different segments of your population? But
Yeah.
first and foremost, when it comes to fraud, waste, and abuse, I'd actually spend a little bit of time advising startups in that space. And that's not where Function is focused. We're not trying to eliminate that stuff. We believe fundamentally, and this goes back to our mission, that proactive and preventative health is a right and not a privilege. And right now it is a privilege. There are people who cannot afford access to preventative care, and that's not okay. And so from a public health standpoint, we're trying to actually figure out how do we get tools like Function into the hands of people so that it doesn't cost them anything. But we're not ignoring fraud, waste, and abuse. For example, if you come onto the Function platform and you're trending negatively on heme A1C, glucose, and insulin, let's say your numbers are like 6.1, 120, and 25 across those three biomarkers. We don't diagnose on the Function platform, but you should automatically pre-qualify for whatever diabetes prevention program it is that's offered through your employer or through your health plan. If that's Virta or Livongo or Twin Health or something that's set up through your carrier, you should be there and you should go there. We believe that we should be using that data to be more precise with respect to actually helping an individual get that care, not with 6 or 9 month old adjudicated claims data, but with, I just got my lab results and please let me know about the diabetes prevention program that's available to me. And so in that context, it's about using that data in a much more targeted way to try and address and be more efficient in handing people off into the existing healthcare ecosystem.
There's also the profile, and you alluded to this earlier, Brock, of women in PCOS and those who are high flyers of the healthcare system because they're not getting the answers that they need. Their issues are not being resolved. There's the profile of individuals who are walking around with a general malaise, foggy brain. Think of women who are perimenopausal and not getting the answers that they need because the female hormone panel is not included in your standard annual physical. So they're going from doctor to doctor, and those are high flyers, and that's a lot of medical utilization. And what we're finding that comes through in our own member stories is that Function literally turns on the lights for them and connects the dots where that could have been avoided. Some of that utilization at least could have been avoided had they had access to the data that they do because of the Function platform.
Yeah. And
To the dots sooner.
I just want to issue a PSA to the women listening to this. It's unfortunate, but you have to work extra hard to find providers who are able to go deep on your needs. I've seen it firsthand with women in my life who have really struggled with difficult hormone related issues, and the amount of people who just female doctors too, and even specialists who just go, yeah, we don't really know.
Yeah, or it's stress. Maybe you just need less stress. I just looked up a shocking stat. I thought the number was closer to 50%. It's actually 93% of women report not being heard in their physician visits.
Yeah, there's definitely a market out there that can help with this kind of stuff, but you definitely have to go look for it. I think women definitely need to feel empowered on their own healthcare journey right now. Just having seen it with some close friends and family, it would be incredibly frustrating if I were one of those women in one of those positions.
Yes.
Yeah.
And from a health equity perspective, that those numbers are only amplified for those who are African American or Latino. So it becomes a health equity issue as well.
Yeah.
O'Brien, one of the things that you mentioned was, what does the healthcare ecosystem get wrong about proactive and preventative care? And I think in a way it's kind of, what do population health managers get wrong? And we hear a lot from people like, hey, you're just focused on the worried well, right? That's 30% of the population that you're going to go target and segment. And yes, you can get them to engage in the healthcare ecosystem because they might be hypochondriacs. And that's one of the things that we're really trying to refute, and we're trying to encourage employers and health plans to actually take a different stance on it. So much like 15 or 20 years ago, we used to refer to people as diabetics. We don't do that anymore. We talk to them about, because they're people with diabetes. That's not what defines them. They don't deserve that adjective necessarily. And we're seeing continued focus on the notion that preventative care is just for the worried well. You really, I think, need to segment those populations and truly understand what's driving those people to engage in healthcare. And are you seeing overutilization from some of those folks? Yes. But it actually is people like women with PCOS who are suffering and don't know why. It is people who are top performing athletes and they just want to continue to be top performing athletes, and they want to continue to Make sure you don't see high cost claimants in your population. It goes beyond that as well. We think about engaging a population in the constructive segments because we're a consumer health company first. So we try and help employers think about not just reaching that 30 or 40% that already engage in health programs, but that you need to think about it on the continuum of an innovation curve. And we have 5 different segments: the innovators, which are early adopters of new health tools. They're curious, they're experimental. We have achievers, they're performance-driven employees who thrive on measurable progress. So a lot of white-collar workforces, high-tech workforces, financial services. We have pragmatists. These are people who are grounded, practical. They want clarity, not complexity. The 4th is delayers. You're starting to get into where you're going to see some high-cost claimants, right? So they're well-intentioned, but they're completely overwhelmed. They want to improve, but they really lack direction. And they may have had a bad experience in the healthcare ecosystem and don't want to go back. All the way down to the 5th category, which is the skeptics. They're disengaged, they're reactive. This may be a blue-collar workforce. Men of the middle age, they don't act until there's a crisis or there's an incentive. And at Function, what we're trying to do is really turn that on its head and say, you can, as an employer, you can target all these different segments and get different types of people to engage in proactive and preventative health. It's about that education, and it's about being able to craft and create content and build a message that gets them to engage in their health at their own moment.
So let's unpack that, if you don't mind, because that was going to be a question transitioning into population health management here. There is not an HR person or benefits person that I've talked to in the last year that hasn't said something to the effect of, our communications aren't working, our people don't understand what they have, they're not educated. Like, we just really struggle as a population to communicate health benefits, healthcare needs, and then to support people through their journey. So what are you seeing as best practices for addressing those different segments?
I would say start with education, start with the notion that those different segments, each of those people are going to be motivated in different ways. If you look at our social platforms out there, LinkedIn, Instagram, TikTok, et cetera, there's a new piece of content every day. Sometimes it's really serious and it's talking about somebody's health scare. Sometimes it's really funny. And that's a great video recently of a firefighter talking about menopause and trying to educate women about hot flashes, for example. And because we're a consumer first company, we have several 100,000 members who are all engaging in their health. And most of those are direct to consumer. And most of those are paying $499 out of pocket for Function. And we have learned over the course of history of our company how to engage people in their health. And it's not just certain segments of the population. And that comes back to the messages you actually create. So, for example, and I'm looking at my notes here, if you're trying to hit the innovators, you want to be able to position and build benefits to position that benefit as the credible clinical upgrade. It's real medicine. It's not marketing. And you talk to them about the notion that they are an innovator. They demand the highest quality medical insights, and you can have access to a program like that versus a delayer. Again, a delayer where they're well-intentioned individuals, they're overwhelmed, they lack direction, they want to take action. You have to talk to them in an easy, motivating way and actually outline for them what the first step is to get involved in their health, which is a very different thing than how you would talk to an early adopter from an innovation curve standpoint.
Yeah. Or an achiever who is performance oriented and, hey, you're going to be able to go get more. Oh, okay, great. Yeah.
Yeah. And in that context, like what we end up doing every time we deploy a program is we create content, but we listen to the employers. I wish I could show you the calendar that we have of different health themes throughout the year where we listen to the employers and we say, hey, what are you trying to talk to your population about right now? What are your themes for this year? What are your themes for this quarter? And we'll create content around that. And so we can help in that construct by actually providing that medically tailored set of information to try and educate and drive engagement in these programs.
Tracy, this might be a question for you. Thinking about the different industries, like I think there is an element of the achievers group, which is the high finance, consulting, tech, who, if you can help them optimize themselves and be more effective, more cognitively aware when they're doing their work, more focused, like they buy into that because that's how they think about their work. So there's an element of this where it's okay, that group should take care of itself if it's just creating awareness for that group. But the unfortunate truth is there are a lot of manual labor, low wage populations out there who are way underinvested in. They're not making as much money. Their benefits are more expensive generally. They take it from all sides. Like, how are you communicating this to those employers? And like, why are you seeing those employers who are engaging start to engage? What are they buying into? And then how are you getting that message out to the people?
Yeah, what we do with employers is provide them with a complete toolkit of communications that they're not starting out with a blank piece of paper. Brock already spoke to the timeline that we put together, which is a calendar where we collaborate, right? So between their consultant, who is often involved in these transactions, the individual client, and us, the three of us come together. And it's really a collaborative conversation because we understand that we're not the only thing being launched, right? There's a whole host of employee benefits that are available in their strategy. And to your point, you and the client have worked very hard to pull together a suite of solutions that will be meaningful to the individuals. But as human behavior is, people don't typically engage or remember that they have these things if you're only communicating just at launch, right? So it's about more than just communicating at launch. It's that constant drumbeat of communication throughout the year and the communication in a way that's going to be most meaningful to the population that you're communicating to. So if it's a manufacturing population that doesn't really use emails and might be on the go, maybe it's providing break room content. Maybe it's going there and doing a lunch and learn in their organization, lunch table pop-ups. So it's a number of things that we pull together to make sure that we're getting the message out in a way that's tailored to that population and is going to be relevant and engaging for them from their perspective. We're also often asked by consultants, what is the right profile of client? And so it's really any client that you would recommend that their population goes for annual lab screenings. I don't think that there is a client out there that we would say, oh, you don't need annual lab screenings. So it's any one of them. And certainly we offer testing that's beyond just lab screenings. We have MRIs as well, and we'll be expanding that. But if you would recommend it to those clients and you would recommend it to all, we're seeing pickup across tech firms, manufacturing firms, financial services firms. We even had a fast food restaurant that is launching. So those are hourly workers. But to Brock's point, we have over 300,000 members, mostly direct to consumers. So the demand is there. People are demanding access to this type of information. It's just in how you position it to them and how you speak to them. It needs to be in a way that's engaging for them, where you're not talking down to them and you're not coming off like you're trying to sell something to them. Brock spoke to this much more detailed, where we're really trying to educate people and bring up their education about how they can take steps in their own health. So it's a robust communication plan. We sit on the same side of the table as the client and their consultant to create a communication strategy that will be most engaging for that population.
Okay. Where does diet and exercise play into this? And I know you've each listed stories where people took control of their health. They saw that their biometrics were off. They took control of their health. They changed their diet. They started exercising. They lost a bunch of weight, which is easy to say, but lifestyle change is really difficult. And so where do you see diet and exercise coming in, and how are you supporting that?
Yeah. So in our platform, Brock mentioned this earlier, in our platform, we have a robust library of content for individuals that really puts into context the biomarkers, the lab tests that they complete and what they are, right? So if it's apolipoprotein B, ApoB, what's ApoB? I've never heard of that. And so what is that biomarker? Why does it matter? Why do we measure for it? And then if I wanted to start today, if this is out of range for me and I wanted to start today, what are the first couple of things that I could be doing to make that impact? And like most every chronic condition, it comes down to our lifestyle habits, which are so easy yet so hard to change, right? Nutrition, physical activity, stress, and sleep. Those are the four pillars that are incredibly hard to make changes. And so we try and bring them in front of the individual in front of the member in a way that's bite-sized, and they can take action in a way that is achievable. So if you think about, there's a BJ Fogg, right, in small steps and taking small steps in behavioral coaching. That's what we're trying to go after, is providing people with achievable steps that they can take in the platform in the form of our care plan, that they can take action on each one of these things: physical activity, nutrition. We even include supplements in there because oftentimes it's just a supplement that can address things. For example, if you have migraine headaches, they may recommend some supplements to address that. So those things are all included in the platform, and we contextualize it for people because it's based on what their specific results are, not just generic guidelines.
Yeah, we're doing so much with our platform that's going to improve how people think about taking action, particularly around nutrition and supplements, changing food choices, et cetera. We'll be excited to share more with respect to the product roadmap as we roll out over the course of the next year.
Yeah, it is. I mean, it's unfortunate, but those two areas are such daunting hills to climb for people. It's funny because I have been active in fitness for a long time. I recognized early, for whatever reason, like if I make this part of who I am now, it'll just be part of who I am later. And so I got that part right, but I'm not a great cook. And so I've got one so dialed in. The other one, I still make terrible choices and can off ramp. If I haven't planned it out, I can off ramp into an unhealthy choice pretty easily. And so it's interesting. Like I felt it on both sides myself. Just on one hand, it's, oh, there's such power to doing this the right way and setting this up the right way. And on the other hand, I'm just like, yeah, this is just such a tough hill to climb.
Yeah. It's funny you say that because we had a group that we launched this with, an organization that runs a bunch of golf clubs all around the country. And they had function offered as a general benefit for their general managers. And they were very interested in understanding, as one would probably assume, a lot of the general managers were middle-aged white men. And a lot of them are dealing with what I'm dealing with, which is elevated lipids and heart health risks. And we ran through a bunch of AI chat exercises where we talked about how do they actually improve their health and make sure they're on the golf course by the time they're 85. And one of the questions that came through was around, I don't know how to take the next steps with respect to nutrition. And so that AI chat is the perfect opportunity to hop in and say, hey, create the 3-day meal plan for me and give me the shopping list that I can use and the recipe that I can use to go make healthier choices on a day-to-day basis. And that's how we envision people using that platform. And that's why we see 50% of our members come back every week to the platform to gain access to function, because it's daily interesting insights that they can put into action for themselves.
And that is available now?
That is available in November. Yeah.
In November.
Yes, we've been using it as employees, testing it and training it. So it's been like a coach in my pocket. When you talk about nutritional guidance, that's what I've been working on, because for me personally, I had a lot of nutritional sensitivities. And so I had to shift my diet a bit. And I've been using it like a coach in my pocket to help me put together meal plans for myself.
I love that. I will be spending more time on the Function website in the future, because I could use that as well. Yeah, I realized in prep for this that I got a lot of great insights. I shared them with my physician, but I had not been fully utilizing the platform to its capability. So this was a good reminder for me. And again, I'm engaged, so I get how hard it is, but it was a good reminder for me to get back engaged again. After this, I'm going to be scheduling my 6-month blood draw as well. And one thing, I don't know, I felt like I should say, this might be a no duh, but if people are listening to this and they hear that there are 100 blood panels being run, like, again, this might be just too stupid to say, but it's not 100 blood draws. It's 7 or 8 different vials of blood with one stick. It goes by in 5 to 7 minutes. It is pretty easy. So don't think that it's overly complicated to go in for the visits. It actually is fairly simple and fairly quick.
It's one of the best pieces of feedback, actually, is the Quest phlebotomists and how great a job they do making people feel comfortable.
Yeah, the longest part of it will be waiting in the Quest waiting room.
Yeah, true.
And the most interesting part will be to hear who else is in there for a function test.
I was talking to the phlebotomist about it, and the person in front of me was doing function, and she said, oh yeah, we're seeing a lot of these days. So yeah, you guys are out there. You're in the market.
We haven't talked about cost yet. Should we talk about cost?
Let's do it.
Yeah.
Tell me how we're going to make this affordable for people.
Well, there's that. And then there's the medical costs on the back end for the employers. I'm a former CHRO or RO, I ran a health plan, and to this day, we continue to have quarterly conversations with our carriers about high cost claimants, and there's very little we can go do about it. And the challenges we run into with proactive and preventative health are that, the average tenure of employees is too low for me to invest in them. And I think that's a flawed thinking, particularly amidst an environment where you've got 9%, 12%, 17% annual increases. Like, we have to come together as a medical community, as a population health community, and say, we need to draw a line and start investing in early disease detection and avoidance, because this is untenable. And you go talk to any CFO in the country and you know that it's untenable. One of the most critical things that we can do together at a health economics level is to use data like 100 biomarkers tested twice a year and connect that back into the medical claims data, working with organizations like Lockton, working with our own individual analytics teams to connect the dots between biomarkers as a proxy for disease diagnosis and how you can actually influence medical claims. We did a study recently, which we can link out as part of this session today, with the Integrated Benefits Institute, nonprofit think tank in the health economic space, basically attaching that data and looking at the differential between what it mean to catch stage 0 prostate cancer versus stage 4, or what it mean to catch prediabetes and apply early intervention versus wait 4 or 5 years. The differential in that latter instance is the difference between $5,000 and $30,000. And so there is an economic ROI model here, and that's what we want to be working with employers on in the early days here, to be able to actually set the stage so that we can go have these tougher conversations with carriers and with our CFOs about how does this actually move the needle from a cost standpoint. And we'd love to share that with anybody who's interested.
Yeah. So what does the reporting look like that an employer would get?
So the reporting is, we start with your typical engagement and enrollment data. It's enrollment, it's churn metrics, it's how many people are re-upping at the end of the year and participating. It's testing completion. So are you finishing your first round of tests, your second round of tests? It's monthly and weekly program activity, and it's where they're going on the platform, like AI chat versus are they going to go look at their wearables integration, for instance. The population health data that we provide, it's done in aggregate, and we provide basically disease burden information, biological area by biological area. So you can actually see in much more real time than you would see with adjudicated claims data, how your population's trending. Are there issues with people who have heart disease? Is kidney disease something that's up and coming that you need to get ahead of? And you can use that same data to say, okay, where am I seeing improvement? We recently sent a bunch of reports out across about a cohort of about 100,000 of the people in our consumer population, and 30% of those folks were trending negatively in HbA1c, glucose, and insulin. And on average, I think 40% of that 30% had improved from their first to their second test. And so we want to be able to provide that data to employers so that they can actually look at the reporting on a regular basis, and not only be able to go to their CFO and say, yes, I'm actually starting to see health impact here, but also ask the question, of all the things I've invested in my ecosystem, if it's point solutions or if it's certain programs for musculoskeletal or cardiovascular disease for women's health, are those things working? Are they achieving their desired results? Because objective data is critical. And so using function data, not only to look at, is function working and is proactive and preventative health working, but what else is going on within your ecosystem? And can you start to draw a straight line between investing in programs like this and being able to address specific disease areas?
Yeah. And if you're large enough as an employer, if you're self-funded and working with a broker that has a data warehouse where you're getting the utilization data, you should be able to integrate this reporting with that reporting. And so you could see not only what's going on with the function population, but how does that compare to the rest of the population?
Absolutely. And that's what we want to work with you guys on is, frankly, we built a model with Integrated Benefits Institute that anybody can have access to. If it's your broker, if it's your consultant, if it's your own analytics team, feel free to use the models. But we believe that's actually the pathway to trying to make sure people have access to these new programs. But there's also the other side of the equation, which is like, how are you democratizing access?
Yeah. We talked a little about communications before, but just one more question on that. As companies make the decision to invest in something like this, do you see them talking differently about health with employees? Do you see different language, the culture shifting? What does that look like for the companies that engage in this, who see the best outcomes? Like, what are they doing differently
Great question.
to model health?
Yeah. You on your platform, you saw the biological age calculation, which is like
Yes.
the difference between chronological and biological age. And it's
Yeah.
a collaboration of
It was in the right direction.
the right direction.
It was younger than my chronological.
Yeah. So I came out of a big consulting firm, and we used to sit around the table and we talked about our Myers-Briggs test results. Like, I'm an ENFP and I'm an INTJ. And here's how we interact together on a team. We're starting to see that take place, but actually around health information. So people are sharing their biological age and then starting to compare and even creating little playful competitions amongst colleagues, talking about their own health and then what actually drives their biological age. And so we are seeing a really meaningful, significant shift. And that's where a lot of the content comes into play, is how do you get people to really engage in these programs and create that culture of health within an organization or within a family, getting your dependents up on function, for instance.
Yeah. And I wasn't surprised. I'm fairly healthy, but I was happy to see that I had knocked 7 years off between the two. I feel like we have covered a lot on this. I guess the one thing you mentioned earlier that's still hanging out there is add-ons. Do you want to hit, there's the core 100 blood markers or panels that get run, but then there's a whole bunch of add-ons. Do you want to just hit what that is and how those work and how people might want to think about them?
Tracy, you want to reference a few of them?
Sure.
Allergies?
Sure. There are a number of add-ons that you can include. Our population and members really value this because it allows them to personalize the insights they get about their health. Some people already know coming into the testing what they might want to add on because maybe there's some family history around something. They're already coming in with some concerns. Maybe there's cardiovascular history in their family, and so they come in and do the add-on immediately. Other folks may be coming in and take their baseline test, and then depending on the results, they want to dig a little deeper. But what it just means is for each of the members, they get to personalize the insights they get about their health and their own health and biology understanding. So some of them include autoimmunity, food sensitivities. That's one that I did because I had been feeling like I had food sensitivities for years and have been getting waved off by doctors. And so this confirmed what I knew I was probably struggling with. Autoimmunity is something that's coming up a lot in populations. I was just having a conversation with a functional medicine doctor yesterday. Autoimmunity is also growing within populations, and that one seems to be another concern. So those are just some that are offered. There's a heart panel, an extended heart panel that can be ordered. So there are a number that can be included. And then we also fully integrate with Gallery by Grail. That is a liquid biopsy where you are testing for 50 different types of cancers through blood testing as well. That is also available through our platform, and you don't have to jump out of our experience to enroll in that. It's fully integrated in our platform, as are all of the other add-on tests that you can take at any time. You don't have to do it when you enroll in the program. It's available anytime to add on and order those tests. And then most recently, I think Brock already mentioned this, but we acquired a company called Ezra, and that now brought scans, function scans to our platform. Those are available through 100 locations, I think just over 100 locations nationwide right now. Eventually, the plan is to get to 1,000 locations, but that is also an add-on, and there are a number of packages that can be purchased from the platform for full body MRIs. Incredibly important when Brock was already saying about democratizing access to this type of advanced testing. MRIs are not available unless you get a prior auth, and a prior auth is going to be dependent on symptoms. And symptoms, again, are only catching up to disease burden that's already there. You're not proactively getting at anything. So people want to be proactive about understanding their own biology, their own health, and the state of their own health now. We're providing that access through the platform, through the additional add-on testing, the Gallery testing, and then the MRI testing as well.
Wonderful. Thank you both for coming on the show and talking through all of this. I think it's really interesting, and at the very least is worth thinking about if you're an employer or if you're an individual who wants to get better control of your health. I think it's one thing to look in the mirror and maybe be like, oh, I'm a little heavy, or I don't like what I look like, or yeah, I know I didn't eat that well, but it's another to actually see the blood work and be able to say, oh, okay, I'm faced with the truth of the scenario here.
Yep.
And I do think there's a lot out in the world today that encourages us or nudges us down a path away from health. And so the more that we can do to be armed and start to rebuild a culture of health as individuals, as companies, and as a society, hopefully, knock on wood, the better we'll all be.
Can I make an ask of maybe folks who might be listening to this, particularly those who are employers and health plans?
Yeah, let her rip.
This is about public health impact, honestly. Like, we believe this is an 8 billion person problem and everybody should have access to their own personal biological data. And that is a pathway towards changing the trajectory we're on as a healthcare ecosystem, both in health outcomes as well as the massively increasing costs that we're seeing. And Function right now, we fundamentally believe that proactive and preventative health is a right, not a privilege. And right now, unfortunately, it's a privilege. And the ask of employers and health plans is to go on this journey with us. Regardless of what your budget is, we want to be able to democratize access. And so if you can afford $100 towards a Function membership, Function can match that and reduce the price to $299 on an HSA and FSA eligible basis. But over time, that should be $0. We do have health plans and employers who are really putting pressure on preventative care guidelines to go in and cover Function on a first dollar preventative basis. That's where we want to head in the future because we believe everybody should have access to this. And so we want to encourage folks to go on the journey. Even if you don't have any budget, we can figure out a voluntary program for you to go in, offer Function, people can pay out of pocket, and you can start to collect data on what a new realm of proactive and preventative care looks like within your population, even if you have no budget. Let us know. We'd love to go on this journey with you. We are very much focused on making sure this is a democratized benefit and everyone has access to it.
Wonderful. Thank you both again for coming on. Thank you, everybody, for listening, and hope it helps improve your health and the health of your population.
Yep. Thanks, O'Brien.
Thank you.
Hey folks, one last thing before you go. If you enjoyed the episode, make sure to hit subscribe so you can stay up to date with future guests. That's it. Thanks for coming. Go make the most of your business and the people in it.